Okay.
Okay, fantastic. So I'm going to make certain assumptions here that many of you are in healthcare already or in health tech in some form or the other. And the topic I've been given to just discuss with you is around identifying and then building a sustainable health tech solution. The motto or my ethos is around the fact that there are problems, but problems are actually meant to be flipped over to see opportunities. And that's the way I think. I think if there's a problem, you can do very, very little by griping over it or by standing as a critic. You want to criticize all the parties that have been involved or by blaming, pointing fingers. I come from the perspective that if you can, why don't you look for solutions? Africa's population is on a growth trajectory. I'm sure you hear this over and over and over and over. But I need you to always, when you hear data or hear information like this, to think in your mind, how is this an opportunity? If you embrace that mindset, I promise you that your life of building solutions will be a remarkable one. And it will be an enjoyable one because really nobody is calling you to come and build solutions. You're the one that has chosen to do this. So if you're going to do it, you might as well do it well. I built Advantage Health Africa out of an idea to aggregate. And why did I think it was necessary to aggregate? It was because it was just too glaring that simple mom and pop shop type pharmacies were just not going to cut it in a country and a continent that has very few chains of pharmacies. They'll always have the shorter end of the stick, where you have big pharma wielding the money, wielding the stick, wielding the data. If you are a small player, single, alone, and no support, you'd hardly get ahead as you should. So aggregating pharmacies made sense to me. But you see, in my background, I had aggregated banks. I had aggregated 9 top banks to form a consortium that deployed ATMs across Nigeria. So aggregating was not new to me. That was my main project when I worked in Accenture. Therefore, seeing my own industry, I thought, oh wow, it's a no-brainer. Let's aggregate. And it made sense to pursue it. For some people, it was innovative. It was like, wow, how? And within a few years, within a year and a half, we had aggregated 1,000 pharmacies. What was the point of aggregating? First, to have strong access to markets, access to skills, and then access to resources. For me, my eyes were on accessing resources because if I play in the middle of a formidable market that can access resources, there's no way that some of it will not come to me. So that was my vision. But I needed a quick win, and my quick win was my medicines. My quick win was to show those that I had aggregated. There were less than 200 at that time. That look, I can bring you orders that would never have come to you if you were not in this group, if you were not on this platform, if you were not in this aggregated format. And therefore, I enhanced their own access to a market that they wouldn't have had. And that led to the first online pharmacy on an aggregated platform in Nigeria. Mind you, when I started this, I searched for online pharmacy and I found one. I actually found an online pharmacy. So my medicines is not the first online pharmacy in Nigeria. However, the model that I found could not scale. I saw the owner of a pharmacy that had a branch in Ibadan, I'm sorry, in Ikeja, and a branch in Abuja. And I thought to myself, if a demand comes up in Kano, how's this person going to meet it? No, you can't meet it. In fact, you're so limited to just your own inventory in Ikeja and in Abuja. And I wonder how long it will take you to deliver. And sure enough, on their platform, they wrote there that will get you within the next 72 hours. Medicines are not electronics, they're not dresses, they're not shoes. They are almost always needed within that same hour. So I knew that that model would not work. Therefore, what I created, and I lay claim to it, is an aggregated platform that can deliver medicines to you within a number of hours, 1 hour, 2 hours, 3 hours. And we're averaging 2 hours right now. We started averaging by averaging 4 hours, and our goal is to average 45 minutes. That is a goal that is worth spending time, worth spending yourself, and putting resources behind. We've done over 200,000 transactions, and no one says we can't do a million. We need to scale these transactions. We've made growth every year from when we started. Yes, of course, when COVID came, our growth leapt by 10 times and so on. But the point is, you must start with thinking of sustainable solutions. So I could have just bought it, and I had actually had 2 or 3 physical pharmacies at that time. I could have bought, no, not then, shortly after, I had a physical pharmacy and then bought another and then bought another. But when I started, I had no pharmacy. What I thought was a more sustainable solution was to borrow the inventory of those who were already sitting on inventory that they were using, but cycling that inventory slowly. Wasn't fast enough, wasn't efficient enough, because ideally you should circle inventory once a month. Some of them were circling inventory once 3 months, once 6 months, once a year. So inefficiency was in the system. But what you look out for, you look out for problems that others have, and you come with a sustainable solution that you can bring to help them. Whether they are the users, they're the providers, they're the regulators, they're the government, they're whatever, they must play a role in the ecosystem, and your solution helps them to get better. Whether more efficient, more profitable, more effective, or impactful, more something, so that at the end of the day, it's a win-win solution. Healthcare in Africa, looking at our population trajectory, is going to hit, it's going to keep underperforming. Our population is not decreasing like you have in the West. Our population is not stable, is not stagnant as you have in some Eastern countries. Our population is growing at an alarming rate. In Nigeria alone, it is estimated by 2050 will be 400 million people. Who is going to serve these 400 million people with food? Who is going to serve them with shelter? But more importantly, who is going to serve them with healthcare? Right now, about 70 to 80% of them are paying out of pocket for healthcare. This is not sustainable. Out of pocket payment is not nice. It is not helpful. It is not friendly. It means that the day you have to go and care for your child or care for yourself, you will decide whether to go or buy food for the house. Things are getting harsher for these same 230 million people, and soon they're going to be 400 million. I hope you know that in IDP camps, one of the fastest things growing there is the birth of babies. So poverty does not reduce population. In fact, it seems to enhance it. Because of that, we need to be alarmed at the rate of growth of population in Africa. It is estimated that we will have 25% of the population of the world by 2050. Who is going to serve them with healthcare? Right now, the traditional orthodox methods are not growing fast enough. They're not expanding rapidly. And they're not able to, even if you throw more money at it, because even right now, we're losing people to other countries. We're having dilapidated facilities. We're not investing enough in our systems, and technology is not playing a major role in the forefront. So as healthcare providers and health tech solution providers, we need to embrace the fact that Africa needs sustainable solutions to address the needs, not just current needs, but the needs of people in 25 years' time. There's a generation being born now called Generation Beta that will be 25 years, 26 years or so in 2050. Who is going to cater to them? So that's what drives my mind when I think of healthcare solutions. And I look back, okay, if I'm projecting for the next 25 years, can I look back at the former 25 years and who has thrived in 25, 30, 40 years? I look at the likes of Dangote, he's the richest man in Africa today, but he started in the 80s. So he's got a leap of about 35 years ahead of me. And I can therefore project that if I look into the next 25 years, I'll be a billionaire. I'll be probably the richest person in Africa, and so on. So it's not just altruistic reasons. You also look at yourself and look at trends. You look at the likes of bank owners, you look at the likes of construction companies. They've thrived in the last 40, 50 years, 30 years, 35 years, 25 years, 15 years. Therefore, it gives you hope that, okay, if I start now, in the next 15 years, in the next 10 years, in the next 25 years, what am I able to do? And that's the lifespan that I want you to carry in your mind, because I have seen an increasingly uncomfortable trend. I'm uncomfortable with the trend. I've seen increasingly a number of health tech innovators who think that they should have broken through in the 3 years that they started, or in the 5 years that they started, or if you were early like myself, when we started in 2017. So this time now, it's about 8 years. I started January 2017. So they think that they should have broken through. And I agree, everything you do should be successful. From the first year, it should be successful. But how do you measure your success? I would love us to measure success on the sustainability plan rather than just a quick win plan, because entrepreneurship must be seen as a long-term journey. So give yourself grace, please. Give yourself 20 years, give yourself 10 years. I have given myself an additional 10 years to thrive in this sector. So how many years are you giving yourself? Many of you are in your 20s. So you can comfortably give yourself 25 years. And I'm saying by then, the landscape has changed completely. Africa will be exporting almost all of the manpower that the world will need. But not just manpower, it's also solutions. And therefore, let one of your solutions be critical for serving Africa and serving the world. And I hope that this has helped you to see the basis of why this topic is so important. We need more sustainable solutions to address the needs of Africans and even the world. So, first of all, conduct your market research. Understand the healthcare landscape, the trends, and the challenges. Like I told you, I looked out and I saw single silos, independent parties all over Nigeria, and even they were not enough. If you look at the facts that WHO presents us, it almost showed me that Nigeria needed about 200,000 pharmacies to serve 200 million people. And when I did the math, I looked at the numbers. I actually went and got the data of the number of pharmacies across Nigeria. And I saw less than 5,000 licensed pharmacies. I heard there were 20,000 PPMV, those are patent medicine stores. I heard there were 60,000. I heard there were 200,000. No one could point to actual numbers for patent medicine stores. But the facts I could get were around pharmacies, licensed pharmacies, less than 5,000. And then when you dig deeper into the data, the market research that you have, the information you have from your market research, I could see where they were concentrated. Lagos, Abuja, Port Harcourt had more than half. Then I also saw that if you mapped it out across local governments, we've got 774 local government areas, but less than 200 local government areas had a licensed pharmacy. What are you saying here? I was seeing that over 75% of LGAs in Nigeria did not have one licensed pharmacy. So all these things were speaking to me that I cannot build enough physical pharmacies to meet the need in terms of aggregate numbers. I cannot build them fast enough to meet and cover the scope, and I cannot build them strong enough to serve the people. I therefore needed a tech solution that would help to scale and leapfrog, and that was justification for my medicine. So I'm telling you, what is the justification for what you're doing? What is the number? What are the numbers telling you? What is your market research doing for you? Prior to setting up Advantage Health Africa, I had attempted about 8 years ahead to do a market research, and my driver was my research assistant. So he helped me to distribute 500 questionnaires across Lagos. When he was dropping them, I just gave him an idea, go like this, go like this. And he came back and we had feedback from people, analyzed the survey. The report is still on my laptop till today. And I know the appetite then but the people were happy and willing to aggregate. Over 90% said they would aggregate if it will help their buying power. So understand the healthcare landscape, the trends and the challenges. Maybe you need to speak to some doctor. Maybe it's a qualitative survey you need to carry out. Maybe it's a secondary analysis of already existing data that you need to carry out. Like me, it was a primary analysis as well as a secondary one. Then engage stakeholders. There's no way that you can thrive in this thing without finding stakeholders. Talk to the professionals, talk to patients, talk to the who is paying. Everybody knows today that health insurance is what is meant to pay for healthcare. Right now, we have less than 10% of healthcare being paid for by health insurance. And I've just flipped numbers because recently this year, last year, 2024, the head of the NHIA mentioned that they had signed up, let's say, about 19 million people all across Nigeria, blah, blah, blah. And for me, that's less than 10%. So if health insurance that is meant to pool resources to fund healthcare, if we look at the benchmark countries, Brazil, UK, and so on, then I need to begin to speak to those payers and see what their pain point is in scaling. Maybe your solution will be to help the payers to scale, broaden their ability to aggregate funds, and then it will have a ripple effect across the sector. This is the way I need you to begin to think, and I'm sure that some of you are already thinking in that manner. And analyze the healthcare data. Find out where is it hurting. Is it in prevention? Is it in promotion? Is it in treatment? Is it in rehabilitation? Look at all the stems of healthcare. If you look at it from the universal healthcare perspective, and then say to yourself, oh, it's in palliative care. Oh, wow. Palliative care is so underdeveloped. Oh, wow. Palliative care, who is it addressing? Cancer, chronic illness, and so on. And then it helps you to create a niche that is needed. Well, almost all of us are in treatment. I'm in drugs, so I'm in treatment. Some other people are in clinics. Some other people are in primary health care. Some people are deploying nurses to homes. Some people are deploying doctors to homes for some prevention, but most of us are in treatment. But I know someone like a doctor who's gone and positioned himself in promotion. He's in healthcare promotion and he's doing a fantastic job there. And I'm sure he's analyzed the healthcare data and his work over the years to pull millions of followers to listen to him and do when he says has been incredible work in healthcare. So analyze the healthcare data, utilize publicly available data to identify the gaps in care. So I've looked at it from the prism of universal healthcare. You can look at it from the prism of what are the verticals in healthcare right now. We've got pharmaceutical care, clinical care, medical devices, nursing, physio. Look at those verticals and see where the gaps exist. The second area that I would like you to look at is seek first to validate your data or your idea, please. I know some of you have built, you've sweated in coming up with a web platform or a mobile platform or whatever solution you've developed. But please treat it as a pilot, treat it as a version 1. And in your mind, be ready to go all the way to version 10 before you do stop. We know the guy that went to version 100 before he finally got the light bulb, right? So you are in version 1, don't give up, all right? Use your version 1 as your minimum. This is a minimum viable product. Use it to create a basic version of your solution and go and test it. Throw it out there. Let people say, it doesn't have the, okay, it's giving you insight on what version 2 will have. Oh, it's too slow. It's giving you insight on what cloud services and so on you should do. It took me a lot to find the button to press send. Okay, your UI UX has to improve. Create that basic version and test it with a small group of users. Many people test it with free users. I try to shy away from free users because it might distort the insight you are getting. Because you might test with only free users, come up with a paid platform, a paid solution, and nobody is willing to pay. So test every aspect, test the product, test the pricing, test the placement, where you place it. You place it in groups, or you go one by one, or you go to a bank, you go to partners, and so on. Test what language to say that will hit people differently, that will make them come on board. I have a micro health insurance product that we started in 2022 February. We call it My Advantage. For us, it's a medication insurance solution. Every other thing we've added has come from reflection, from having tested the minimum viable. But we positioned it as a multi-level marketing product. We said if one person likes it, he'll tell four people. Four people will tell four people. And we put all sorts of sweet solutions that we didn't get far. So we knew we needed to pivot. The product in itself were adjusted small, but we pivoted to then going through an association. We got a lot of mileage there, but the association itself truncated. So we've been changing, twisting, moving. Ultimately, you think of sustainability. And when I think of sustainable solutions, I'm thinking in millions of users. So while I am dissatisfied with the uptake so far, it's a minimum viable product. It may be version 6. I think we're on version 6 right now. But remember what I told you, be happy and willing, be joyous, be kind enough to yourself to know, don't worry, version 12 may crack it. And that's what makes entrepreneurs look a bit crazy, because some other people will give up when you are still at it. So conduct that user testing, get the feedback, gather the feedback, put them in the right buckets, and keep building. But it's difficult to keep building when you don't have funding. So you may begin to look at your competition and say, how are they doing it? How did they do it? Do they have funding? Maybe you look for a seed funding. Do they have some subscribers so they're paying ahead? Maybe you look for that. Do they have a portion that is free? They call it freemium, and then a paid version. Just look at in the landscape and see what's going on. And you may not always get competitors to research in your sector. I saw my competitor, so to speak, my comparative model in the agri sector. Was from agriculture in Kenya, that I saw dairy farmers aggregated and a payer stood between the dairy farmers and the providers of their supply. And that makes sense to me. So sometimes you have to look outside of your sector, outside of your country, outside of your comfort zone to get what you're comparing. Then, as quickly as possible, assemble a team, or make sure your team is not just like you. In healthcare, we tend to want to band it together, but no, we must find someone from the arts, someone with social sciences and humanitarian perspective, someone who knows how to speak to people about healthcare without it being like, they're almost dying. They must be able to speak to people and let them adopt healthcare as though they're adopting mobile data, or as though they're being entertained. So your team must be more than you, it must be different from you, it must be a complementary team. And I always ask you, do you need a co-founder? If you do, fine. Or you need someone to outsource a portion of your service to, then outsource. You need to hire some people, then hire. But it's so easy nowadays to say, I want a co-founder. And I always say, okay, be careful, if you have the liberty and the freedom to choose a co-founder, excellent. If your co-founder is foisted on you by your founder, then be careful how you agree terms, because sometimes the business itself is fantastic, but the arrangement of leadership is poor, and then it goes bust. So foster a culture of innovation. When I was building Advantage Health Africa, I came from a perspective of building organizations with a culture. So culture was so important to me from day one. And so in the early days, we used to meet, the 4 or 5 of us that started. We used to meet every quarter. Every quarter, we'll find some nice restaurant that we couldn't really, go by ourselves. And we'll go there and we'll talk about our culture before we talk about what's going on. Till today, we still rest on those 6 culture pillars that we built from the beginning. We have an acronym for it called Africa. So when you say AAT, what's Africa? It'll tell you be audacious, fulfill promises, respect for yourself and others. I is innovation all the way. C is collaboration, and A is Africa wide. The cultural norms we have fortified my team through thick and thin. And I think that as early as you can, find what you cherish and build on it. We haven't changed our cultural, our core values, not change them. Every year we revisit them. Every year we revise them. This year again, HR is talking to me how instead of it being the leaders that will champion the discussion every Wednesday for 6 months, let me get the team members. I said, fantastic, make it team members, but put it in groups. So I'm no longer the only driver of the culture in the company. It's now percolating within the team and develop a strong network. I don't think I need to overemphasize that. We know in Africa is who knows who, man no man. It is who knows who, connections and all that. So go for the connection rather than gripe that it is who knows who. Go for the connections and set up your own team. Walk tall into a room, smile at more people. The way Isaac connects with me is fantastic. I haven't met him in person, but he's brought solutions to help me. I'm glad to get his solutions. I'm happy to speak at his events. He calls on me, sometimes even checks me. I think he checks me for advice sometimes. So we form the connection. Find those connections. I tell you a nice story. When I was going to start advancing, my medicines, October 1, 2017, I had forged a relationship with someone prior to starting, and he had a close relationship with the regulator, the registrar of PCM. So through him, I had a relationship with the registrar. So I helped them create a solution for the PLSP. I committed to running it for 10 years. He was addressing his own pain points. So it now came to me asking him for something. And I said, I need audience with you. I'd like to present something I'm doing. And I went to meet him. Prior to that, people had told me there's no regulation that supports online pharmacy. And I said, yes, I know there's no regulation for online pharmacy, but there's also no regulation that says online pharmacy is banned. So the way I saw it was that there was no regulation for or against. Therefore, I needed to preempt regulation. I needed to think what was happening. And luckily for me, I thought, okay, if this, so I came up with some criteria that we built into the solution. And I went to meet him confidently with it. I said, sir, I'm going to launch an online pharmacy, but I have preempted some of your concerns, and this, and this, and this, and this is how we address it. Oh, prescription. Oh, must be handled by pharmacists. Oh, this is. By the time I explained, words from his mouth were, this is the kind of thing we've been waiting for. That gave me sail to move on. Regulation did not come until 5 years after I launched. So when pharmacists were kicking against what I was doing, thinking it was taking, away from physical pharmacies, I remained strong and steady because I had heard a word from the regulator. So don't shy from your regulators. They are human beings. Anticipate their needs. When they were forming the body, sometimes they would consult with me. Sometimes they didn't consult me. I didn't take it personally. All I knew was I had come, I had disrupted the sector, and my solution was working. From day one, we were solving problems. Even though the first month, maybe we had less than 10 inquiries and others. The next time it was 15, but it grew organically to where we are today. So develop those strong networks and find some form of funding. Some of you may look at grants. Grants are more popular now. When I started, they were not. I'd run a grant program, but it wasn't yet preponderant. It wasn't common. So I'd run a program at the Tony Elumelu Foundation as the chief operating officer. And I left there knowing that there's money in this world. So if you ask me what did I take away from my job, it was that there is money. But the money was chasing very few opportunities, very few entrepreneurs. So the purpose of Mr. Lumelu then was to democratize luck in such a way that if you've been chasing just 10 entrepreneurs in Africa and you say these are the only ones to back up, I'm going to be churning out 1,000 entrepreneurs every year for the next 10 years. Such an audacious, goal he had. And for me, that showed me that there's money out there. And many of those guys have gone on to raise additional funding. His own was just take $5,000, prove this concept or not, and go on from there. So explore grants if you can. Explore venture capital, but they have an appetite that you need to understand. And so if you can meet their appetite, fantastic. Explore angel investors. I explored angel investors when I started to raise funds in a formal manner. But the first thing I started with was, of course, my savings. My was largely my savings. I didn't quite get money from my parents or my but at least they supported me in a way. My mom didn't understand what I was doing for a long time. But my brother told her one day, is she coming to you to ask for money? So she backed off, because she was worried I had left a very cozy, very cushy job that was paying me millions upon millions. The salaries I was earning then, some people are not even able to dream about it here now. I was flying private jet, going up and about. But I left that to start this thing that did not even make sense to her. I remember recently she saw someone speaking the kind of language I speak. And she said, you should collaborate with him. I said, oh, yes, he's one of my mentees. He's learning from me. Oh, okay. So she could understand better what I'm doing by seeing it outside. The point is, explore funding, explore crowdfunding, explore my juiciest funding suggestion is subscription. Please find who will subscribe to your service. If they can subscribe, they are prepaying you. Even if they subscribe on a monthly basis or a weekly basis or a daily basis, you can use their subscription to calculate and take some fund decisions. Then, if you can, please develop a business plan. It's almost always helpful. Sometimes it's all you have to wake up to and say, I'm going again. Sometimes it helps you to identify loopholes and risks. So a business plan is not just an Excel with, okay, I'll sell to 2 million people by 18 months. Look at the billions. And then, yeah, it's fine. It's beautiful to have those billions and all in your Excel. Reality may hit differently, or you can always go back to the numbers to encourage yourself or to recalibrate, or even to say, okay, this does not work, and come up with another concept paper and a document that helps you. It helps you to think through the various parties that are involved, stakeholders. And I love the business model canvas. So if you get a business model canvas, it will guide you to think through. I met with one of my mentors back there, Remy Adisho, and when he heard what I was doing and all, he drew the business model canvas and and it helped me to think through. And I said, oh yes, I've done this. Oh yes, I'm doing this. Oh, so it gave him confidence that I have thought through. So if you can, even if it's a one-page business model cover that you help yourself with, do it. Then I started to think of partnerships. I'm probably one of the first or earliest HealthTech innovators in Nigeria to forge the broadest partnership with health insurance companies, HMOs, with health innovators. At a point in time, it became clear that health innovators were just telling themselves, if you need drugs for any part of your own work, don't bother, go to my medicine, they will do that part. So we have several partnerships that have started since 2017, and they're still going on strong now, where they go, they get the prescription, generate their own pricing. We don't care what you charge. We will fulfill the order as though we were you, and it goes on. We do it for general care, rural health, so for doctoral when it was on. We've done it for so many of these innovators, and those partnerships have helped. They added just last month, we're now partnering with Lashma. They just assigned 200,000 lives to us. So those partnerships help you to ramp up your numbers and also help you to see the need. And it helps you also to know who to work with. We've got a partner that says, oh, in Lagos, I use a few providers as aggregators as pharmacy benefit providers. But everywhere outside Lagos, it's you guys. I don't have any other pharmacy benefit provider outside Lagos but you. That's because very quickly we established ourselves as the only aggregator that had presence in all the states in Nigeria. So leverage resources and partnerships, collaborate, research, work with industry partners. You'll be able to access their own expertise, their own data, their own infrastructure, and their own spread moving forward. And I think I mentioned this already, ensure regulatory compliance. I went to meet the regulator myself. Some of you, the regulator comes to meet you. But you see, many of us don't know the power of government. There are three key things that you must carry as the founder of this health tech provider and solution. You must carry the funding part in your head, you must carry your staff, your team, and you must carry your government relations. So very early, there's someone in my team that oversees government relations. Even though we all have a part to play, but I have earmarked government relations as a key thing to monitor. Team, of course, and then finances. There are so many agencies that are springing up. You must catch up to them. You must familiarize yourself with the relevant regulation. If it doesn't exist, find out what's happening in India, find out what they have in Kenya, find out reports, read reports, subscribe on some of those reports, the Excellent Advisory. I subscribe to their newsletter. I've been part of their surveys. So that's a formidable, entry point for me to know what's going on across Africa. And consult with them if you can, meet with them, visit them, know someone who knows someone who knows someone, but get into their good books. Right now, there's a lot of noise about data protection. What are you doing about that? Any one of us that is involved with people's data, we must know. So find out what's going on there and develop a QA management system. Early in Advantage of Africa, when we had begun to expand and grow, and we now had two clear lines of business. We had a pharma aspect and we have a digital health solutions aspect. So my medicine, my advantage, and so on. Pharma, we have physical drugs. We have franchise over about 40 SKUs. And now we finally have NAFDAC approval for our own first product. So we have a line of about 21 that will be registered with NAFDAC. And the point is, I clearly see we have two lines of business, and each one of them carries their own different risks. And then there's an organizational risk. It was important to me to come with some of the background of quality assurance that I had to put in here, because if you're a chief operating officer, you must focus on quality. I focused on quality so well that at the time when a regulatory body came to the Tony Melu Foundation, we welcomed them, they sat with us for 2 days, went through all our papers, and they found us excellent. That is how much I focus on quality. I brought that atmosphere to my business, and I thought, how can we say, what, let's go for an ISO certification. Let's certify our processes that they meet ISO standards. And I'm happy to say, when we hired someone, she took us through the processes, audited us, aligned us. There was someone appointed as the QA. She leads QA. And then internally, 3 of them went for the exam. So we became, so focused. And we went through ISO certification because certified for 3 years. And so each year you renew. And last year, we now renewed after 3 years. So we're on the second one. For me, it's a thing of pride and joy in a country that has very poor appreciation of quality. Otherwise, why would people be selling drugs in the open market? Final slide. Focus. Focus. If you want to grow your numbers, whatever it is you are tracking in your numbers, and for some people it's impact, for some people there are other metrics that they monitor. For me, please make sure you're tracking your financial growth. We've grown year on year on year. Even last year, that I thought was really slow. When the numbers came out and compared to 2023, there was still a 20% growth. But I want to see more growth. I want to see jump leaps, 10 times, 20 times, not 20%. But we'll get there. But we're on the journey of sustainability. We're ensuring that our solutions can be scaled to meet a growing demand. Remember, I've seen that the population is growing. So by whatever I do, population will grow and demand will keep growing, so long as we're meeting satisfactory customer service. but we must be profitable because it is from your profits that you can expand and grow. Some people, their strategy is to keep raising funds, and it makes sense in some climates. It does not make sense in all climates. So if your goal is to keep raising funds and increasing and doubling and Xing your valuation, that's fine. Just look at sustainability for it and focus. For some people, it's the number of branches they have. I know a guy that is just scaling his number of branches of laboratories, medical labs, and so on. And now they've gone outside Nigeria. Because if you go outside Nigeria, whatever revenue you're making is in dollars, and therefore it can help you to manage the fluctuations in the interest rates and devaluation. For some people, it's in the number of team members they have. I'm happy to say we crossed the 100 people mark and we'll keep growing. My goal is to have the kind of business like an MTN that's got 21,000 employees. Imagine that I, Abimbola, thought of something in my head, came out with it, and 21,000 people are employed through it. That's awesome. That for me is awesome. So, what are you tracking? What are you monitoring? What are you evaluating? Make sure you have those KPIs. For me, make sure one plus the others. So one is that you must become profitable. Do not over rely on external funding to keep you going. Otherwise, you probably don't have a business. Maybe what you have is an impact-led solution that you then need to look for grants. So if you're looking for grants, then don't kid yourself that, but for me, I've used a combination of grants and business revenue to keep going. And our goal is to increase business revenue so that grants will be like 5% and the revenue itself will be like 95% of what is keeping us going. And always keep growing. There's a big, huge sky over there. Healthcare is one of the least developed in terms of health tech. And it is still, health tech is still fastest growing because there's a huge landscape ahead of us. So the landscape is evolving. Africa is opening up. There are all sorts of acts now, AFCTA, whatever, to make sure we can do business across Africa. There's all sorts of changes in policies in the US and so on. We need to look inward to make sure that we're growing our sector and we're providing healthcare to Africans. Thank you so much.
Thank you so very much, man. I learned a lot. I really appreciate you
Thank you.
coming. Just like everyone that I heard about you from before I met you, spoke like just nail on the head.
Sorry, I didn't hear you.
I said just like I heard about you before I eventually met you, like virtually, like you just hit the nail on the head. I really need to talk to me about you while I was at INC Consulting. Yeah, thank you so very much. So, does anyone have any questions? So we can answer your question before we end. With your mic.
If you don't have questions, I have questions for you. So, do you have questions? Oh, okay. Since somebody has a question.
Okay, someone go on.
Okay.
Good evening, ma. Thank you for the time so far. Um,
Mm.
I would love to ask a rather very specific question. For a place like Nigeria, where the reality is that tech adoption is very low, it's almost ridiculously low. It's a real hindrance to building tech solutions. How do you find that balance between the service end of things and the tech side of it? Because as much as you want to say adoption is low, leave tech a little bit. The tech actually helps what you are doing and it can't be ignored. How can you find that balance in whatever idea you want to build, you want to work on?
Okay, so I don't buy the general sweeping narrative that tech adoption is low because the information available to me says otherwise. Basic tech adoption is quite high. Quite a number of people that use USSD directly on their phones, or they go to a place and somebody helps them to use USSD. Nigeria is notorious for data consumption. I had a friend working in a place that when they started um, buy credit, meaning buy your data on credit, their company was the one that innovated in that regard. At a point in time, they were selling 10 billion naira worth of their services. And if you sell 10 billion naira on a daily basis, what are people using that data for? They're using it on platforms based on tech. The other part is that USSD is very, very important. WhatsApp is very important. I'm sure your mom, your parents will send you WhatsApp messages warning you not to drink cold water after eating amala or something like that. So there's strong adoption of messaging apps, and there's also a preponderance. So lots of people in certain demographics who are on social media platforms. Some are on Twitter, they sit there. Some are on Instagram, they sit there. Some are on Facebook and they pack themselves there. Some are on LinkedIn and they're hyping themselves there. So when you say tech is not being adopted, which tech? Now, if you say that doctors are refusing to use electronic records or electronic management systems to capture customer and patient information, translate it and write prescriptions, that's a different matter. So you have to come with a user interaction and user experience that mimics what they normally use. Many of them are on e-commerce platforms, purchasing stuff, trusting and receiving their goods. So why don't you mimic that? Many of us want to build sophisticated technology without having understood the buyer pattern and the user patterns of our targeted market. If my targeted market can easily set up a Facebook account, then I should make sure my is such that it's as easy as setting up Facebook. If they are on banking apps and they are fine with banking apps, then one of my first partners should be a bank or a fintech. And I just go and pally them, give them 50% of my profit, whatever it is it takes for me to be able to leverage their users who are already comfortable with them. So when you say tech adoption is low, I think it's a narrative that you need to start changing and flip it over and say, how can I make use of how tech is adopted right now to get where I need to go to? So I began the WhatsApp groups in pharmacy sector. I became the first Telegram group to use to start teaching people. Every Sunday, thousands of pharmacists were gathering there to learn from me. I began a system where I set up 3 WhatsApp groups for the aggregation of pharmacies, and I was churning out content to them. 10 a.m., they were sitting waiting for my content. So I embraced what was being used, and it was a messaging app. And based on that, I built my solution to help them access skills and access markets and eventually access resources. It was on those WhatsApp groups that we set up a funding solution that we built in funding for pharmacists. So whatever you are building, I think the first question is what do they use right now, rather than oh they don't use. That narrative of they don't use, it just kills your fire. It slows you down. It deters. It doesn't help anybody, and it's really a lie. It's a fallacy. That's my perspective on it. Anybody else?
Yeah, let me you can go on. I think that's good. It's okay. Olamilekan. Okay.
Somebody
Any
else has
echo?
raised their hand.
An
Please go
echo?
ahead.
Good evening, ma. Thank you very much for the wonderful presentation.
Thank you.
My question is about how we can validate our business idea. Is it from the data that is available, or when a user start paying that we can say the business is validated? And also, how can we rely on that validation? Maybe a user is paying and also what the user needs to build the business, and also disrupt maybe the previous idea we coming with or milestone we already set out to follow.
Okay, I'm struggling to hear you, Anika. You said, how can you validate your business idea? Is it through data or user or the fact that people are paying for it? So I heard that part. What was the second part? How about disrupting your idea?
So I was looking based on after user start paying, do you base your what's next, what comes next on what the user demands for, or what you think the data and maybe the data available is still speaking, or what the user actively requesting?
Okay, let me ask you a question. Do you have a health tech solution right now?
Yes, ma. Currently working on one.
Can you tell me what it does so I can probably contextualize my response?
Okay, our tech solution, which we are working on in this program, Medinnovate program, is about the primary healthcare assets in which we adopt the already existing technology and also AI to facilitate um, patient and doctor connection. Most of the processes that patient has to undertake is already automated, in which diagnosis can be done, and then the patient is being linked to the health provider as fast as possible.
Okay, so which solution is like your solution?
Oh, this one I didn't get to know.
Which solution are you building?
The um okay, what solution we are applying in this case?
No. You've just described a primary healthcare solution to connect patients to doctors. And you said on the platform you're going to utilize AI and you have data and information about the patients already on the platform for the doctors to make consultation and prescribe. Is that not what you said?
Yes, ma'am. Yes.
I said, which solutions in the marketplace are like yours already?
Okay, ma. We have telemedicine, different telemedicine platforms that already their solutions is not directly the same. Most of them are owned by hospitals already. So, and also some of them are not AI powered. They actually have people who respond to calls from patients.
No, 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 no. See, I'm not asking you to qualify or describe. I just want you to mention existing ones because what I would need you to do is to see how, what's their uptake, what is their success right now, and how can you match that success or exceed it? Is it the number of people paying for their services? Is it the number of grants they are getting to back up their solution? Is it the number of hospitals that are signing up? Is it the number of state agencies that are backing them or supporting them? There must be something you are measuring to see we're moving forward. And it's not generic, it's not the same for everybody. It may be the number of paying users. For some places, it's not the paying users that shows them because they may be paying suboptimal fees for now. When they will pay the actual amount is later. So it may be the data you're getting from their utilization that is now showing you, you know, we're making something here. We're discovering that more people have leprosy than we thought was existing in the country. Oh wow, maybe neglected diseases is an area to look into. And you're opening the eyes of practitioners regarding a disease condition or a trend or a pattern. There was some guy that I know, he set up something for sexual health. From there, he realized he needed to create some games, some books, some solutions, sell drugs to them on sexual health. So it was their interaction on the platform, the questions they were asking that informed his own next level. So if you know what you're building and you know those who are building like you, even though their features are not the same as yours, you must be able to benchmark on their traction. Is this helpful, Anita?
Yes, ma. Thank you, ma. But ma, so in other words, you mean like where we have to follow is not generic. Maybe I should kind of recap. So we have to look at it from both sides and make evaluation, and then decide on whether the data we are getting from the user at present is going to decide what we are going to do next, or
It's
I
everything.
don't know.
It's everything. It's users paying, it's data you're getting, it's partnerships you're forming. Everything will inform your next step. Which is why I asked you if you're doing anything already. But once you start doing it, all of these things will add up. It's not one thing that will inform your next steps. So do first, release your first version, see the kind of feedback you get, whether there's a pushback, whether there's an adoption. That will inform the next step. So don't be in too much of a hurry for version 2 when you've not released version 1.
Thank you very much.
All right.
Thank you so much.
Anybody
Does
else?
anyone have any?
Is anybody building anything in pharmacy here for the pharmaceutical sector? Okay. So over to you, Isaac.
Okay, thank you so very much, Ma, for joining us this. Thank you so much very much once again for joining us this evening. Super appreciate your support since we started Medinnovate. I must also mention that
I'm not sure I can hear you clearly. Can you speak closer to your mic?
Samuel, do you have any questions?
can you hear me now?
Yes, go ahead.
All right. I want to say thank you so much once again for joining us this evening. I also wanted to also thank you for supporting us since we started. Actually our biggest partner, taking over 40% of our interns from our internship training program. Super appreciate all the support, and thank you for taking your time to talk to talk to us, the emerging entrepreneurs here, looking to see what becomes of the ideas in the next 10 to 15 years, which started from here. Super appreciate once again. So we have come to the end of the call.
Thank you so much. And I wish all of you the very best. May your solution